Start already.
All right, we're going to get started. So, somebody's hijacked the doctor, so bear with me for a few minutes. This is the kind of presentation we put on every couple of weeks. Kind of a presentation from the doctor, some in-depth information about not so much the products, but more or less the ingredients in the products and the latest scientific findings, things like that. So this month, as you may or may not know, is Arthritis Month. And you see behind me, this was an arthritis walk that a lot of the members clubbed together on and did down at Irvine, which I think people had a lot of fun. You were there, I saw. Did you have fun?
Yes, I had fun. I took the pictures.
You took great pictures.
Yes.
All right. So arthritis. Apparently, there's like 50 million people in the US who have arthritis or some form of arthritis. Now, you always kind of tend to think that, it's never going to be me, that's somebody else, that's people who get really old. But here's a shocker. And you know what those are? The typical pouches. Anyway, x-rays. So, for the last like 6 months, 7 months, I've been driving my car, and my leg's getting sore, and then my lower back's getting sore, and I go to the chiropractor, get some work done. Go to the massage therapist, get some more work done. I tried acupuncture. And 6 months went on and the pain just never went away. And then I thought, well, maybe something is really wrong here. So I went to the doctor. I hate going to doctors. So I went to the doctor. Said, yes, let's do some x-rays. Did some x-rays. I have arthritis in my neck. I couldn't believe it. So my jaw dropped and the guy said, yeah, we'll just manage it. I said, well, what do you mean by just manage it? I'm only 46, I'm not going to have arthritis. But apparently, there's people out in the street walking around with arthritis just like me. Some are in pain, some are not in pain. And it just made me realize that it's not about kind of being discovered with arthritis. It's like, we should really all take care of ourselves so we don't get arthritis. I always thought of myself as this really somewhat kind of fit person, looked after myself, ate pretty well, took supplementation, but it just goes to show you can still get arthritis. So we have some products at FKC, which I wish I'd been taking for 20 years, and then maybe I wouldn't be in this situation now, but anyway. But the moral of the story is, we may not think we're going to get ill or whatever the ailment, but supplementation is just one way to take out nutritional insurance, really. So the yellow folder was just a kind of eye-opener, so avoid the yellow folder. All right, we've got a few people here tonight who we're going to have up on stage. First of all, Dr. Kane, who's a member of our advisory board. And then we have a few other guests who are going to speak afterwards. So we'll start with Dr. Kane. A big welcome for him.
Thank you very much. Thank you. Microphone went out. Thank you, Jason. Thank you, Lauren. Thank you, everybody at FKC, and thanks everybody here for coming. And thanks everybody out there in cyberspace, right? So arthritis really is a big deal. We're going to get this thing set up over here. And it affects millions of Americans and people worldwide. And what's interestingly enough, we're starting to see it at even younger ages. And there's different types of arthritis problems. There's rheumatoid arthritis, and there's osteoarthritis, and there are differences between both. But essentially, it's a very crippling disease, and it's beginning to happen at more younger age. Do we have the channel changer? Yeah. Oh, very good. So today's topic, we're going to talk about joint health. And our joints are made up of a lot of different things, and we're going to take a look at that. All right, once we get this thing going. If we get this thing going. So anyway, what is arthritis? Just a little sticky. What is arthritis? Basically, arthritis is simply the loss of the joint surfaces between the joints, okay? We have many joints in our bodies. We have small joints between the fingers. We have larger joints between the legs, shoulders. The joints are just basically the joints, the connections between essentially the 2 points. And it's not to be confused with osteoporosis, which is basically a decrease in the bone mass or decrease of calcifications, where the bones become very weak. This is more of a joint disease between the joints, where osteoporosis would be more in terms of weakening or thinning of the bones, which happens on many people as they get older, okay? And again, the loss of the cartilage or the space between the joints, essentially, as it becomes more and more severe, the bones and the cartilage start to rub against each other, right? And obviously becomes very painful, inflammation, developing bone spurs. You have less lack of mobility, a lot of morbidity that occurs with that. And between the joint spaces, believe it or not, we have fluid-filled sacs, which are mostly filled with glucosamine and other sugar type of padding. Okay, so that's some of the basics of it. And basically with progression over time, you get destruction of the underlying tissues, and this is a really bad process. So if people who do have arthritis, particularly osteoarthritis, but even many people with rheumatoid arthritis, can benefit tremendously through lifestyle changes, rehabilitation, and also certain supplementation. I will show you why. Okay? Now, how does it present? With arthritis, it can present either in a slow, gradual fashion, or slowly just start having pains, as Jason was mentioning, etc. Or you can have good and bad days, where some days you'll be doing very well, some days you'll be doing very bad. It depends on the type of arthritis you have, it depends on where you live, the condition, your age, and lots of other factors on how physically active you are. You could be stiff and achy in the morning, you could be comfortable during the day, you could be stiff at night. It varies from person to person. So just so you know that people with arthritis is a very broad topic, but the bottom line, they all have the same problem, where the joints are basically essentially rubbing against each other and causing destruction of the tissues, okay? And setting up a lot of inflammatory responses, okay? A lot of times people don't understand that when people with arthritis, the doctors will recommend that they do some moderate exercise against what you think that you want to rest it. But the truth of the matter is, some moderate exercise can actually build up the cartilage, build up the fluid between you naturally. So moderate exercise in most people with certain types of arthritis is actually beneficial. Just generally moving around is what the key thing is, and not moving at all. That's the key, okay? So prolonged positions will aggravate the problem, increase symptoms. So people who are in a certain position all the time without doing much motion or exercise in that area will aggravate the arthritis in that area. Or you have difficult activities, kneeling, squatting, stair climbing. These are people have more severe arthritis. Some people have such a problem, they can't even tie their shoes, put their pants on, etc. It's extremely debilitating disease, okay? So a lot of people have trouble even waking up at night, or they do wake up all the time due to severe joint pain. So how do we make the diagnosis? I'm just going to do a kind of a general overview, and we're just going to go through it quickly. Basically, on a physical examination, someone with an arthritic joint will generally have tenderness in the touch, they'll have weakness in the muscles around them, they'll have loss of passive and active motion in their legs, okay? They can have spurs. Sometimes you can feel the spurs, which are like bone spurs, spurs coming through. They'll have a grinding, popping, or other kind of joint noise. Whichever joint you move, you'll hear these kind of noises. It's always not good to have noises when you move your joints, okay? Essentially, sometimes you'll have catching or locking, like some people get the knee would just suddenly lock all of a sudden, it'd be very difficult to move. Or they would have things like fluid on the knee that sometimes have to be removed due to chronic inflammation, okay? So lots of different things that you'd find on physical exam, and a variety of such depending on how severe the symptoms are. And there are additional tests, such as x-rays, that are done to just take a look at what the bone fragments are, how the bones kind of look. So an x-ray would be part of the exam to take a look to see also if the patient may have osteoporosis, which I mentioned, thinning of the bones, or other associated issues that can mimic those symptoms, okay? So what are the options if someone gets diagnosed with arthritis, depending on how severe it is? Well, remember, there's different types of arthritic changes. There's rheumatoid arthritis and there's osteoarthritis. Rheumatoid arthritis, just so you know, is more of an autoimmune type disease where actually our body is fighting our own joints. And usually people with those type of arthritis have arthritis usually in the hands and the smaller joints. You have these type of look with their hands. Those are classical rheumatoid arthritis, but the majority of people will develop osteoarthritis, which is basically arthritic areas in the bones and the typical aches and pains, okay? So diet and exercise, there's no question about it that nutrition with certain supplementations can actually build up joint space, fluid, be like vitamins for our cartilage and our bones. There are supplements and basic exercise that we can do that can be tremendous, which are one of the non-surgical options. There's rested joint care, especially for the acute symptoms. When you have an acute system that all of a sudden it's really hot and flary, you need to rest at that point. There are other canes and walkers that can help in severe cases. We'll talk briefly about them. There are actually prescriptive medications. There's cortisone, which is a steroid. There's glucosamine, which is a well-known supplement that we have obviously in our products as well. And in Europe, it's actually a prescription, okay? And there's supplementation with joint again, calcium, vitamin D, and antioxidants that we supply here at FKC, and braces. Let's look at some of these things. So what are some of the treatment options? Well, short term would be bed rest. When anything is acutely inflamed, no matter what it is, you need to rest that joint. So in the short term, you need to basically put bed rest, especially useful when you have multiple joints. Just want everything to rest and heal, let the inflammation go down. Okay? Individual joint rest is the most helpful when arthritis involves only a few joints. Okay? So initially when you get an acute injury, whether it's a back pain or a knee pain or whatever it may be, especially due to arthritis, you want to rest it off initially. Okay? The average American now, here's another one of the biggest problems, is most people are overweight. The average American is about 20 to 40 pounds overweight. This puts a lot of stress, not only on our heart and all our organs, but on our joints and our bones. Can you imagine? 30, 40 pounds is an extra stress as we walk, as we do these things, and puts extra stress on the joints, and that's why a lot of the joints will collapse. So weight is a major problem. The average person takes about 5,000 to 7,000 steps a day. So basically reducing stress on weight-bearing joints, such as wearing comfortable shoes, okay, the proper shoes, not walking on hilly terrain with sandals, losing the excess weight. These are simple things that we can do that will really affect and reduce the stress on our joints, because essentially the disease is caused by the stress on our joints, okay? Balanced diet. We need to have a balanced diet. We have to help manage our weight. Extra pressure may obviously aggravate your arthritis. We need to stay healthy. We need to eat appropriate from the food charts over here to have a nice balance of diet in terms of proteins, carbohydrates, and fats, keeping obviously our proteins higher and our carbohydrates and fats lower, okay? There's a lot of exercises that we can do with people with arthritis. There's range of motion exercises. There's increased flexibility, relief stiffness. So there's a lot of different things that we can do in terms of special exercise. A lot of the physical therapists or rehab physicians or even just nurses and anybody else in the field would know certain exercises which are appropriate for certain joints that can help, okay? There's also strengthening exercises. There's certain exercises, particularly people with lower back problems and joint problems in the back. There's certain stomach exercises that you can do to help relieve the tension on the back muscles, to counterbalance. There's a lot of things that we can do on most things. But basically, exercise, the whole point what I'm trying to make is moderate exercise is actually one of the mainstay treatments for mild to moderate osteoarthritis to get all the joints moving, okay? What are some of the other things that we can do? Aerobic exercise, not just passive and range of motion. Riding a bicycle, help control weight, improve cardiovascular fitness. So people with arthritis, even moderate to severe arthritis, recommend bicycle riding. You have to go up steep hills, you have to run a marathon, but getting on a regular routine. Even if it's just walking with comfortable shoes around the neighborhood, that can improve arthritic changes tremendously. People with mild to moderate arthritis who walk 20 to 30 minutes a day usually have their symptoms resolved within 3 to 6 months. So it's incredible, with the addition of some exercise and supplementation, okay? What are some of the other heat and cold therapies? There's heat therapies will increase blood flow to the areas. A lot of heat was very good. Cold packs, ice massages, over-the-counter sprays and ointments. It basically just kind of numbs the area down to reduce the pain, okay? Things like that. Physical therapy, again, we talked briefly about it. There's a lot of physical therapy things, basically range of motion, certain types of exercise, which are specific to what type of osteoarthritis you may or may not have, okay? There's a lot of assist devices. There's splits, there's walking aids, there's orthotics, there's bath stools, there's sock grippers. There's a lot of other accessories for people who are actually debilitated with arthritis that can help them, especially in the acute phase when they're really painful. They want to rest the joints. They need to have some kind of assistance to help them walking. Because you can imagine, if someone has a really bad attack on arthritis, let's say in their knee and in their back, and they keep walking, it's going to aggravate the area. So we even have basic devices like that we know. Okay? Walking aids, we're all familiar with canes and walkers. And not necessarily elderly people, even the young people with severe arthritis will be able to use that at least on a temporary basis, okay? Now, in terms of medications, there's lots of different medications in the field, and we're familiar with it. They're pain relievers, they can provide temporary relief for arthritic pains, but the problem with these analgesics that are prescriptive or even non-prescriptive is they don't treat the problem at hand. All they do is give temporary relief, okay? I'll give you the example when I'm talking about it in just a minute. So traditionally, for early stages and for just joint aches and pain, most people will take some type of aspirin or ibuprofen or naproxen or Motrin or something like that, or some of the newer ones, these COX-2 inhibitors like Celebrex and things like that. And just so you understand that your pain may go away, but you're actually causing more harm. Now, what do I mean by that? So imagine this. You have the joint against the joint rubbing, right? And the bone's hitting against the bone, and your body's telling you, hey, something's wrong, and it gives you a lot of pain, so you decrease the motion, correct? Makes sense? So when you take these anti-inflammatories, whether they're prescriptive or over-the-counter like these, all you're simply doing is basically relieving the pain. You're taking down the inflammation, relieving the pain, but you're not resolving the problem, which is decreased. Telephone somebody? Anyway, you're not resolving the problem in terms of the joint space where the bones are hitting against the bones. Does that make sense? So these are temporary reliefs. That's why people who take a lot of ibuprofen for the pains, etc., etc. The bottom line, eventually what's going to happen, it's going to get so bad that that's not going to work. You're going to cause more pain on the joints because you're moving it, because you're feeling less pain, and rubbing the bone more against the bone, and you're not taking care of the physiological problem, which is the joint space where there's a fluid interfill between the area there, which is made of a matrix of lots of sugars with glucosamine and things like that. So if we can build those up naturally, not only will we decrease the pain, but we'll also take care of the physiological problem. Does that make sense? And we know that. So these medicines are good in the acute situation when there's a lot of pain, but you need to realize they just take care of the pain, they don't take care of the problem. Okay? So again, there's other things as well. Over-the-counter patches, rub, ointments can provide quick pain relief, but that's just a few joints. But that's when the pain isn't that severe. So a lot of these ointments and patches, they do kind of the same thing, but it works modestly at best. Again, only short-term relief pain, but you're not taking care of the actual issue here. So how do we take care of the actual issue here? Well, there are supplements. We know this. This is nothing new. We know about glucosamine. This relieves joint pain. Does anyone here know how glucosamine relieves joint pain? Anybody? What's that?
Natural sugar.
That's right, it's a natural sugar, it's a lubricant. It's been studied for many, many years that glucosamine, as well as other additives, but particularly glucosamine, the key thing about glucosamine is, remember I mentioned between the joint spaces, what do we have? We have a fluid-filled matrix, and one of the most prominent components of that matrix is glucosamine. So high purified glucosamine not only will take down the inflammation like an aspirin or an ibuprofen, but will actually build up that sugar matrix between the joints and relieve the problem and take care of the issue at hand, okay? So we know about glucosamine, there's tons of studies on it. Like I said, it's a prescription in Europe. Here you can get it over the counter, obviously, and it's normal and it's vital to normal cartilage functions. And also, researchers are using it for making medicines more effective and helping blood clots and a lot of other things. So there's a lot of other benefits to glucosamine in high doses than just for joint. It's being researched now for a lot of other valuable things in the works right now. Now, it also showed, the studies also show that they help osteoarthritis pain and improve function. Now that's really important. The key point there is improved function. We know that glucosamine taking over time will definitely decrease the inflammation, physiologically increase the fluid between the joints. But one of the key things the studies show is actually improved function, because that's what we're all about. It's not just taking care of the pain. We want to get back to where we were. Do we all agree? People with arthritis want to be back where they can tie their shoes, where they can run, they can walk, they can ride their bicycles without pain, but also be able to have good range of motion. And glucosamine has been shown to do that. Some of the studies indicate that they help as much as ibuprofen in relieving the symptoms, particularly the knee, but with fewer side effects. So not only does it help physiologically the function of glucosamine as well as some other ingredients, but not only that, it's as effective as ibuprofen. And we know that ibuprofen actually is very good for pain. So the bottom line is, and it has fewer side effects. Does anyone know the real bad side effects of taking chronic ibuprofen or Motrin? Does anyone know? Ulcers, that's right. Bleeding ulcers, very common, stomach ache, gastritis, all these type of things. So that's why those kind of drugs, not only, they're only temporary relief for not taking care of the problem. The problem with them also is when people abuse them or take them on an often basis, they develop ulcers, gastritis, these type of things. So they're very dangerous, even though they're over-the-counter drugs, okay? And it's been shown in many, many studies. So here's some other things we know about knee braces. There's different types of knee braces. We're not going to go into all these details, but there are certain braces that we can do to help assist us while we are, or people that we know have it, can be recovering. And again, people with osteoarthritis or diabetes should talk to a doctor when they take glucosamine, because it could influence blood sugar. So every drug that you take, and glucosamine is a drug in itself, you need to always tell your doctor, whatever supplement you're taking, what you're taking. Because certain supplements we know can react with certain drugs in a good or bad way. If you're a diabetic, if you're taking medicine for high blood pressure, clots, etc. So always consult your physician before going on a regimen of anything like that. And again, don't take glucosamine if you're allergic to shellfish. There are other types of glucosamine that you can take that are not related to fish, but in general, just like glucosamine over the counter, if you're allergic to shellfish, you want to be basically a little bit weary of that because there could be some kind of a mild reaction to that. What are some of the side effects of glucosamine? Basically, they're well tolerated. Side effects can occur. The most common side effects are nausea, a little diarrhea, heartburn, increased intestinal gas. But the bottom line, overall, glucosamine, as you know, is one of the safest products out there, and their tolerability and their safety, efficacy over years and years has been probably one of the best around. Okay? Let's talk about, when we talk about knees, this is an arthritic knee, just so you get an idea of a picture on it, you know. Here's the joint, here's the top of the knee, here's the bottom of the knee. As you can see, this is the diseased cartilage. It's already worn off here, the bones hitting up against that stuff. And, excuse me. And these are the two bones down below called the tibia and fibula, and that's basically the disease, a typical arthritic knee, what it would look like. And what do we have? We've got actually some supplements that will help us tremendously. We have Joint Again. Now, that's typically a rheumatoid arthritis, but do your joints a favor with arthritis and make sure you take supplementation as well as exercise and change your lifestyle. And as glucosamine and arthritis cure, well, it helps tremendously. And what we do know is that we have glucosamine naturally in those fluids. And as we increase in age, our glucosamine levels really drop down tremendously. All we're doing is supplementing a natural product for a natural process. So that's why glucosamine is so important. In addition, Joint Again, which is a great product, has also vitamin C, which works for a lot of different things, but particularly in Joint Again, the way it's mixed, it's used also as an anti-inflammatory. It's also a powerful antioxidant. In addition, we have curcumin. We know about curry and curcumin, and curry powder has been used for years, not only for taste in foods, but basically it's a derived Indian spice from turmeric, and it's known as a very potent anti-inflammatory with almost no side effects. And this happens to work synergistically with glucosamine. What it means is that the effect of glucosamine alone and the effect of curcumin alone, when you put them together, is multiplied exponentially. It's much stronger than each one on its own. So it's a synergistic effect, which is the positive effect that we want. And we also have Boswellia that basically inhibits something called leukotrienes, which also basically works as an anti-inflammatory. So in Joint Again alone, we not only have the glucosamine and the high purified natural glucosamine, but we have these other natural, well-known, safe products that work together, not only in increasing the fluid in the area there, but also in decreasing the inflammation. So for pain, better range of motion. Here's a typical arthritic hip. This is your pelvic bone here. Here's your diseased cartilage, right over here up in your joint. And this is what it would look like. Basically, bone against bone, wearing off the cartilage. Again, the glucosamine, the fluid is worn down there. This is your femur, your thigh bone, okay? Over here, this is the skeleton of the hip, okay? And that's a normal hip, how it would look like over there. And again, a joint is formed by the ends of two or more bones. And again, the femur bone is very commonly people get arthritis here because it bears a lot of weight and pressure. So extra people have extra weight who don't exercise, who do those kind of things. This bears a lot of pressure and weight all the time. So over time, that's easy to wear out. And we see younger and younger people all the time getting hip replacements and all these type of things, which by the way, is probably makes the arthritis occur basically 100% of the time due to artificial products inside your body. So that's the type of things you should be understanding, okay? That's your knee joint over there. You have a few other things such as ligaments. That's your patella, your knee joint. You've got synovial fluid in here, all these type of things. The bottom line is when the fluid wears out between the joints and the ligaments, between the bones, and the bones start hitting up against the bones, that's when all the damage starts occurring, okay? And here you go. We want to avoid this. It starts off with a regular knee here, some damage. It gets really bad to the point where you get an artificial knee. Once you get an artificial knee, that's a whole different story then, you know? Then you're dealing with all types of metals and things like that. So we want to prevent that. But even people that have had artificial knees or have had replacements of the hips, those people also do well with Joint Again and glucosamine and things like that, okay? So realistic expectations. You know, we want to make sure for our age, we want to be the right weight, we want to be the right activity level, we want to keep our bones strong. We want to make sure we take calcium, vitamin D, magnesium to keep our bones strong to prevent osteoporosis, which is obviously fitting at the bones, okay? We want to prevent this. Can everyone see this? This is a hip, metal hip here. We want to avoid that if possible. Does everyone see that? It's pretty straightforward, right? So that's why, you know, it's not just taking care of the joints, we want to make sure that the bones between the joints are healthy. And that's what we recommend something like calcium, magnesium, vitamin D. And calcium obviously helps in bone and clotting and muscle contractions. Vitamin D we can get from sunlight, milk products. Magnesium is a muscle relaxant, so there's no tension in the muscles, and helps facilitate the absorption of calcium. So if I take calcium, magnesium, we absorb all the calcium. It's really, really important. And again, we want to get that synergistic effect. Okay, it's really, really important. That's why calcium mag D is a product also that we have that basically is just good for joint and bone maintenance. So not only do you want to take care of the fluid space, you want to take care of the bones above and below, right? Makes sense. Because if you've got weak bones and good fluid, you're going to have a lot of pain to develop osteoporosis. We don't want that. And again, all processes, I'll go through this relatively quickly, but every cell that turns over basically removes something called free radicals, which are poisons essentially in our body. And we want to make sure that we always are taking high doses of antioxidants. We can get it in our diets with blueberries and raspberries and green leaf vegetables, etc. But the key thing is we want to make sure that we supplement ourselves with antioxidants. And again, it helps us also from lots of things, not just from the joint problems, but from blood cholesterol oxidation. And in our tri-antioxidant FKC, we have all natural ingredients: selenium, green tea extract, grapeseed skin extracts, and pine bark. And these all have been well studied, all natural products with essentially no side effects, which are very potent antioxidants. And we need to do that as our joints and our bones are healing. It's very important. And again, we don't have to go through this whole detail, but basically antioxidants are very important because our cells are replicating all the time and releasing free radicals, or called superoxygenated molecules, and we need scavengers to kind of capture them. And our body, as we get older, cannot capture these free radicals. They can go out and cause inflammation, even been a hypothesis for developing cancers. So by taking antioxidants, particularly in high levels, natural ones, we'll be able to capture those free radicals and get rid of them and let our cells mature healing. Okay? So I wish it was that easy, right? To do that, but it isn't. It's going to take effort on everyone's part, but it's a combination of everything. Mild exercise, proper diet, proper supplementation, right? Making sure you see a physician, good activities, whatever needs to be done, because we want to avoid the ultimate of having hip replacements, joint replacements, these type of things. And again, we don't want to end up like this, crippled, right? That's really the key. Does everyone remember this, the Costa Cruise line? Not too long ago, I had to add that in there, right? And again, dietary supplements, the use of joint again, calcium, magnesium, vitamin D, and antioxidant has been very effective according to the users and relief of symptoms in a variety of joint disease forms. And that's come from many FKC testimonials and other testimonials. And always talk to your doctor before taking any type of supplements. As I mentioned before, certain supplements can react to medications. And I want to thank you and wish you all the best, and open up the floor for any questions. And of course, I want to thank FKC for having me, and thanks for attending.
I'm sure there's questions. I have loads of questions.
Thank you.